So should we go ahead and get started? Perfect. Good morning. Can you guys hear me okay in the back? Yes. I said they turned on the recording earlier. I said I'd have to be on my best behavior and not say anything. Forget I was being recorded, right? Yeah, it covers this part of the stage. Oh, we still have a few more people roaming in. Good morning, I'm Shannon Cotsoradis. I am the CEO at the Nebraska Early Childhood Collaborative and really delighted to be here this morning and share the work of our staffed family childcare network with you, as well as how we're thinking about outcomes, both for providers and children. I'm going to tell you a little bit about myself and NECC, and then I would love, since we've got a relatively small group, to hear from each of you. And if you have a staffed family childcare network, or if you're here because you're thinking about a staffed family childcare network, it'll help me tailor my presentation this morning around who we have in the audience. So a little bit about the collaborative. And maybe just a few words about myself before I get started. So I've been with the collaborative since 2016. I'm actually the first CEO at the collaborative. And before I joined the team at NECC, I led the way at a public policy organization in Kansas, where I was for 20 years. So I say I pretty much grew up there right out of graduate school and then made the transition to the shared services work. The collaborative has actually been around since 2014. We are a strategic initiative of the Buffett Early Childhood Fund. They are our primary investor, but since the collaborative was established, we actually have multiple private investors, as well as public funding streams that are supporting our staffed family childcare network. The collaborative does a lot of different things, and since we've got time, I'll tell you a little bit about what those are, maybe good context for today's conversation. We are an early Head Start Childcare Partnership grantee, and I think that's been an important backbone for our work as an alliance. We have 280 slots based in Omaha, while we work statewide, and I'll give you a sense of the reach of our staffed family childcare network. We are based in Omaha, and our early Head Start Childcare Partnership is actually limited to Omaha. We work in 3 large centers for the purpose of that Early Head Start Childcare Partnership grant. And we, in the next iteration of EHS CCP for our team, we hope to expand to family childcare. And really our staffed family childcare network has been an important on-ramp for that work. It's really helped us to build relationships, as well as the strength of our FCC providers and aspiration around that next iteration in our Early Head Start Childcare Partnership. We provide shared services for 6 large centers. Those centers are all part of the EduCare network, if you're familiar. We have an EduCare school that's based in Lincoln, and we have 2 EduCare schools that are based in Omaha, and 3 infant toddler centers, which are sister schools to the EduCare schools in Omaha. The 3 infant toddler centers are actually our Early Head Start Childcare Partnership grantee. We have the statewide family childcare network, which is what I'll spend my time talking about today. We're supporting more than 350 childcare providers across the state of Nebraska in that network. And it's actually grown relatively rapidly. I'll talk a little more about the origins and how we got there. But we didn't really set out to create a staffed family childcare network. It has very organic origins and all the challenges that come with that, part of which is really thinking retroactively about how we'll demonstrate success. And then lastly, we have a couple of new additions to our work. We have both an advisory council for our staffed family childcare network to make sure that that work is really being informed by the voice of providers, as well as a new program we launched in January of this year. It is a replication of an initiative in several other states. Depending on who's in the audience, we may have some that are familiar with parent ambassadors, which is really an effort to lift up the voice of parents around elevating early learning, and particularly in the policy space. And in Nebraska, we have kind of put our own twist on that. We are including childcare providers who are parents or serving children under the age of 8 in our Parent Ambassadors program. So we have our first cohort of 20 that we launched in January. They are a statewide group, and I have to say they are really an amazing group. Their stories are very powerful. Oh, it was working a minute ago.
Well, I'm sure I'm sort of gonna monitor the chat and the Zoom while we do this.
Sure.
Sorry, it's late.
Yeah, no problem. The remote was working, but we're not working now.
Okay, so you want to advance the slide?
There we go. Oh. Oh.
Sorry. How about now?
Yep, we're good. I think we're good. It's not a presentation on Zoom if technology doesn't work, right? Oh, nope.
My fault entirely.
This is a test. So a little bit about, and actually before I go deeper, I'd love to hear from all of you, and then I'll talk about the origins of our family childcare network. So can we start up here and just who you are, where you're from, and if you have a staffed family childcare network or you're looking to build one?
It is my Rogers, and I am from Fort Wayne, Indiana. We just launched the shared service network. Started with family childcare providers, 9 providers, 11 programs, and is doing well so far. And then we are also about to, in the process of adding a couple ministries and school-based programs on to our project. So we are in the infancy stages, and we just hear about it.
Great, thank you.
I'm from North Massachusetts. We manage about 12 centers. We have a family childcare system of about 70 providers. We also manage an R&R. We manage 3 charter schools.
And feel free, if you've got multiple colleagues at a table, if one person wants to introduce your organization or initiative, that's just fine.
So I'm sorry for all of this. So the Zoom folks are seeing the presenter view, and that's why I was just trying to, I mean, not the presenter, they were seeing your notes, but I think we're just that's gonna be what we're gonna live with. However, they can't hear what you're saying, so if you could pass this mic around when you have a question or commenting, that would be so helpful. So
Perfect. I think we were at the back table back there. You've been recruited, Sharon.
Yes.
Good morning. I'm Nicole Norvell. I'm from Indiana. I'm the state administrator there, overseeing our subsidy program, our quality program, licensing, as well as our pre-K program. And as my colleague from Indiana said, we're kind of new into the venture of some family childcare networks.
I'm Allison Zimmerman, and I am also from Indiana with Allison Zimmerman from Indiana as well, working in the same office as Nicole.
Hi, my name is Dawn Thompson, and this is Doris Hancock. We are from Community Coordinated Childcare in Louisville, Kentucky. Our agency has been a CCR&R for like 52 years now, over 50 years. We have a staffed family childcare network. We are a food program sponsor. We have the shared services platform. We are a delegate for 544 Head Start and Early Head Start slots. We are trying to do a unique thing of putting them in center-based care and those, kind of lifting up those high quality centers that we have relationships with. And we do tons of PD.
Hi, my name is Alicia Smith. I'm with Action for Children in Columbus, Ohio. I'm the Family Child Care Services Coordinator. Right now, we are exploring opening a staff family child care network, but at Action for Children, we also service all things child care related, PD, and parental services. So we are the CC and R&R for Central Ohio.
Sorry. Okay.
Hi, good morning, everyone. My name is Ellen Cochran. I am with Quality Care for Children in Atlanta, Georgia. And we do have a staff family child care network, and I won't go into too many details because I'm only my second week on the job, which is why I'm excited to be with Allison, who can also talk more as our partner.
Good morning. My name is Allison LaRocca. I am president and CEO of Luminary Evaluation Group and principal consultant with Civitas Strategies. Really great to be here. And also shout out to Amy. I actually began my career as a third grade teacher in one of the charter schools that we run in Lawrence. But really excited to be here. We study staff family childcare networks. We study the impacts of business coaching and all coaching really for providers and nationally across the country. So really excited to learn from Nebraska and from all of you.
Hi, I'm Jody Lamberti. I'm with the Family Child Care Alliance of Maryland. We are a 2-year-old nonprofit who are trying to be a staffed family child care network. We are still in its infancy. Right now we are working on, we have one main project, which is integrating pre-K into the state-funded pre-K system. No, family child care into the state-funded pre-K system and really pushing for that mixed delivery. So.
I'm Pamela Armstrong. I'm from Oklahoma. I work for Child Care Resource and Referral. We are a DHS grant, and then we have 3 divisions in our area. We have early infant toddler, and then just R&R coach or R&R, and then we have a brand new one, which is the business consultant, which is who's here with us today. We have 8 regions in the state of Oklahoma. I'm just one of 8 regents, and we have we serve all providers, centers, homes. In our area, we have about 200 that we stay in contact with and provide coaching and business consulting and TA and just anything that they need. Then we do parents, but more through the providers.
Good morning. I am Louise Lisboa. I am with the Women's Business Development Council in Connecticut, and we provide training, TA, and grants to childcare providers around the state. And we work with our 12 staff family childcare networks. And so I'm really here in this session to learn about what the networks are doing and how we can better support them as a referral resource.
Hello, I'm Patricia Dishler. I'm here with my partner, Donna Fowler. We're both NAFCC past presidents and came together about a year ago, started our company, Community Coaching, and we are there to support all the systems and networks that are trying to be inclusive of family childcare, help you better understand them. We do data analysis and coaching support and help you spend your dollars wisely, find out what it is that they really need and help you understand their needs and how to support them and give you all the support you need to make sure it's a successful program.
Good morning, Felicia Jackson from Louisiana, Department of Education. I manage family child care strategy at a state level. I'm happy to be here to learn more about how I can better support my family child care network.
I really thought I would be last. Yeah, you tricked me. Maura Snyder, I'm with the state of Nevada, and we just opened up a child care services center, which is we lovingly call the hub, and we serve from centers to school age. So we try to get everyone in there, but it's just brand new. So I'm excited to learn more about the staffed family centers.
Hi, I'm Sheila Ferris. I'm actually a director of a center here in Austin, and we have limited physical space to expand. And so I wanted to learn more about family networks and see if maybe that was a way we could go.
Was that everyone?
Did we miss a table there?
Oh,
Yeah.
okay. All right. Starting.
Good morning. My name is Ashley Beck. I'm the HR manager for Early Learning Neighborhood Collaborative in Michigan, mid-Michigan, if you're familiar. We serve several different areas in Michigan, Grand Rapids, Kalamazoo, and Battle Creek, and eventually looking to expand. But we target neighborhoods that serve Black and Brown students and families. So we provide programming to them and also work with some partners locally to provide early learning and also programming. Yeah, I'm just looking to learn a little bit more about family childcare networking. And also I'm here with Brittany Lewis, who's also my colleague in Michigan.
So I didn't even realize I was sitting between two of my fellow Michiganders from the same city. But Kim Sturgeon, I'm the program manager for Hands Connected Provider Network through Bethany Christian Services. And we started in 2011 with a focus on supporting the startup and sustainability of licensed family childcare homes that are owned and operated by culturally diverse people of refugee background to help serve the needs of large refugee population in our area. So we currently have 22 licensed home-based businesses that we have supported. And I can relate to what you're saying because we started very organically, didn't even realize we were a staffed family childcare network. And now it's like, we're growing. We have 12 new providers that we're supporting with business startup. And it's like, how do we back up a few steps and put some structure around this? So very excited to be here and learn from others who are doing similar work. So.
Good morning, Kim McDougall. I'm with the YMCA of San Diego County, and we are the Child Care Resource and Referral for San Diego County, as well as the subsidy agency. We have about 3,400 family child care providers in our county and support currently, well, many of them, but formally in our pedagogical side of quality improvement, about 225 of those. And we're starting to build out a shared service network to enhance our business side of the house. So excited to hear about all the R&Rs that are here.
Terrific. Well, I appreciate everybody taking time to introduce themselves. We have got quite the range of expertise in the room, so I'll try to modify to that and hope for those of you that are in the room that are more seasoned and have been doing this work for a while, feel free to chime in with your own reflections and lessons learned. I'm sure there are many. I know we have many in the short time we've been doing this work. So just before the pandemic hit, the collaborative launched two partnerships, one with Wonder School and one with All Our Kin. I think most everyone that's here is familiar with Wonder School, the technology platform that really allows providers to manage their business. All Our Kin, if you're not familiar with their work, they are a national organization based in Connecticut. They have two things that have really inspired our work, a business training series, which is 10 weeks long, 30 hours, very intensive, designed with the family childcare educator in mind. We were the first rural state to pilot with them. They brought in a team that actually spent time with us for the better part of a year to train our own team around that business education model, and really were on the ground with us in Nebraska and have inspired a lot of the work that we have done around business training going forward. They also have a licensing toolkit. You'll hear me talk a little bit more about that. That really became an integral component of our staffed family childcare network. So just before the pandemic hit, we launched that partnership, our first cohort with All Our Kin, and we were the first alliance partner to sign with Wonder School and launched with them as well. And then of course the pandemic hit, and it was all about emergency assistance and how we could help providers. Really, again, no intention to create a staffed family childcare network, but we got into these two partnerships and realized that we really needed to take a step back and really look at the range of supports that we provided for family childcare providers and put those together in a way that was more organized, which was really the genesis of our, this is just not going to cooperate for me today. Yeah, thank you. No worries. Next slide, which was really the genesis of our staffed family childcare network. Those two partnerships, maybe Sharon will advance. Just to give you a sense of our reach before I dive deeper into the services, Nebraska is a really big state. I say these are the days I wish I lived in Rhode Island. If you travel all the way out west, you're looking at more than 8 hours. Omaha is on the far eastern side of that map where we are based. So one of the blessings of the pandemic is the ability to use technology in a way with providers that we couldn't really do before. And it's allowed us to much more quickly reach statewide. So what you see is that we really do span the breadth of the state. We are serving both rural and urban providers. And for those of you that have never been to Nebraska, we essentially have 2 urban hubs, Omaha, which is in the far eastern part of the state, and then about an hour from Omaha is Lincoln, where the University of Nebraska at Lincoln is located. Those are really our 2 urban settings, and I would describe the rest of the state as primarily rural. We do have multiple counties with no licensed childcare provider in Nebraska, so we have our fair share of childcare deserts, which was part of our motivation to serve providers both in our urban hubs as well as statewide. The majority of our population in Nebraska is concentrated in Omaha, as are the majority of our childcare providers. But again, for us, part of equity as we think about our staffed family childcare network is thinking about not just our historically disadvantaged zip codes, but also our urban providers versus our rural providers. So to dive a little bit deeper, I'll tell you when we originally organized our staffed family childcare network, we organized it in 3 tiers. What you see now is kind of the 2.0 version of the staffed family childcare network, and there really is a reason for that. I think we learned that the experience of family childcare providers isn't a linear one. And so while I think there's some value in organizing around the tiers, mostly in talking with external audiences for our childcare providers, it was a little bit confusing because you might start in tier 2, or you might start in tier 3, or you might have services from all of those tiers. So what you see is essentially our original organization in the tiers, but now we really talk about, and it's really from lightest touch to highest touch. So from left to right. That this is what we would describe as our first tier on the left. That includes the CCA global platform, that what we call the Nebraska Exchange. It's that's the way we communicate with providers. And so it provides the technological foundation for our staffed family childcare network. We also have a pilot right now with Pi for Providers, which is another tool. If you haven't met Chelsea, she is here this week. A tool for streamlining subsidy management for childcare providers, which we've integrated into that lighter touch tier. It is a tool that's very cost effective, and we've gotten very positive feedback in Nebraska from the providers that are using Pi. It just makes it easier for them, mitigates the risk. I'll talk a little bit more in detail about Pi when we get to technology. They receive our regular communications, our newsletter, social media, that sort of thing, as well as the newsletter that I mentioned. So that's really kind of our lightest touch. Get familiar with the collaborative and the staffed family childcare network, access to some services. In that second tier, we offer our business training series. Again, that is the training series that's based on all our KINS model, the 10 weeks and 30 hours. I will tell you, we do pay providers to participate in our business training series. And really it's the way we talk about professional development with our providers. If I go to professional development, I'm here this week, I get paid for that time. And so we really try in our effort to professionalize the field to communicate that that's also paid time for them. Licensing toolkit, we have and this is all featured on our website for anybody that might want to take a deeper dive. We actually have an unboxing video that a member of our team did. We have 4 boxes. It really takes a provider from the beginning of the licensing process all the way to getting their provisional license. They receive those 4 boxes over a series of time. It has everything from outlet covers to educational materials to get you started in your program. We pair that process with a family childcare mentor who's really walking hand in hand with that provider to the point of getting their license. We do that both in English and Spanish. I should also say we do our business training also both in English and Spanish. And that's, again, for us, a commitment around the issue of equity in our staffed family childcare network. Wherever we can, we're offering those resources in both English and Spanish. Child Development Associate credential. This is really part of our back office support that we've brought to our staffed family childcare network. And the reason I brought a little more context at the front around who we are and what we do, because we support several large centers, we offer CDA at several points throughout the year to make sure that our educators in those early childhood classrooms have their CDA where they need it, because that's an early Head Start childcare partnership. We leverage that for the community. So any community-based childcare provider, any provider in our staffed family childcare network can participate in CDA at no cost. And we do support them through the completion of their CDA, preparation of their portfolio, application for a scholarship for their observational visit, really throughout that whole process. I think for those of you that have engaged around CDA, you probably know sometimes a provider can make it through the coursework, but then really getting to the end of the road takes some support, high touch support. So something we provide through our staffed family childcare network. And then I should say again, we also provide CDA both in English and Spanish. And we have had tremendous uptake around our opportunities from our Spanish speaking community. They have actually been among our most enthusiastic and engaged partners. And we've actually, when we did our first business training series, we had many of them tell us that it was the first professional development opportunity they had had in Spanish. And then we do other professional development as it aligns with the state of Nebraska. So we have in Nebraska what's called early learning guidelines, where there are key domains that professionals need education in for ongoing licensure. We offer that through the collaborative at no cost, again, really to reduce barriers for providers. We also found it was very important around our CDA to offer that. Otherwise, it was difficult for professionals to get the hours they need to get to commit about the domains in which we offer that professional development. On the far right-hand side, what you see is what we now call, instead of tier 3, our elevated providers. So these are the providers we work with most intensively, where we're investing the most time and frankly, the most money. We offer those providers the Wonder School platform at no cost. We do tax preparation, no cost on an annual basis. I will tell you, the first time we did tax preparation, we couldn't give it away for free. It sounded like, you'd think you'd have people lined about the door for free tax preparation, but there were some really important lessons learned there around how reticent providers are to give that very private information over to tax preparers they don't know. So we made some changes before re-implementing that. But part of the reason we have done that is not just offer that service to providers at no cost, but also because that is a strategy for us to collect data. That data is de-identified, so we are still protecting the privacy of the provider, but really critical as we think long-term about how we'll demonstrate outcomes for this very large investment in Nebraska. Mentoring, you've heard me talk about our how we mentor providers in a variety of ways. Brandy Lingle, who some of you might have seen present, is here. She leads the team of our staffed family childcare network. We have folks that are just focused on mentoring childcare providers. That is their primary responsibility. We have a network of what we call quality childcare program specialists, and they both English and Spanish speaking providers that are doing that work. And that's really the crux of their day-to-day work, is to mentor family childcare providers. The Elevate Fund is one of the ways that we address gaps with providers around quality. So part of that mentoring work, and you'll hear me talk about this around some of the data collection, is really to help providers set goals for their program. What are your goals? What are your business goals? What are your quality goals? At the collaborative, we really feel like that business journey is inextricably linked to a provider's quality journey. We give providers so many supports often around quality without giving them the supports around business. And frankly, you can't deliver on those quality goals without the financial resources to deliver on those quality goals. So we really talk about both business goals as well as quality goals. And that is the Elevate Fund are funds that our elevated network providers can access each year. And if we have additional funds, we may let other providers in our network access those funds. And the goal is to help them meet their quality gap needs. So it could be anything from I need a laptop to I need a fence for licensing requirements. We purposely, I would say on average, it's $1,000 to $1,500 for a provider, but we purposely didn't set a cap around that fund so that we could be open to requests that really might make a difference for a provider. Bulk purchasing is something we're not spending. It was more important during the pandemic when it was so hard to get things. So we were doing some supply delivery and helping providers access resources in that way when wipes were super hard to come by, or toilet paper, a variety of other things, days we all hope to forget. And then Elevate, I was sharing with Ellen at the beginning that we do an annual business summit for childcare providers in Nebraska. It's called Elevate. You can find lots of information about it on our website. This year it's in June. And this year, for the first time, we are holding it in Omaha because we moved into a new building and have a new training center. But to make sure that our rural providers have access, we have 8 Televate sites across the state where local partners are hosting. We're doing it in a hybrid format, both in person and virtually. And really with a very heavy business focus. So good news, I know you can't see that and I'm going to drill down. Just wanted to talk a little bit about how we think about the logic behind our model. In part, this conversation isn't just about what we do in our staff family childcare network, but how we're thinking about outcomes. Because our network was one that was very organic, I must admit, we didn't spend a lot of time there in the beginning. We spent a lot of time figuring out how we were going to organize these various services and get the services off the ground in what was really a period of crisis for childcare providers. But we've since stepped back and really thought about what our strategies are, what we're aiming to achieve midterm, and what we hope to achieve long-term. So I'll just drill down and talk about each of these. You've heard me talk about many of the strategies this morning. The Knowledge Hub, that's really the CCA global platform. Business training in our building for our providers that are located in Omaha. We actually have a business resource center. It was somewhat disrupted by our move into our new building, and 3 months later, our move out of our new building, which we've now moved back into. For those of you that lived through not being open and throughout the pandemic, it was a little bit on the disruptive side for the business center. Of course, business software, subsidy and CACFP billing. So for us, we're really relying on the Piper providers for the subsidy piece, business consultation, tax prep, Wonder School, all the strategies you've heard me talk about. Those are really our inputs. What we're hoping to impact short term, and these are really things I would describe as being more at the provider level. This is really about reducing time on administration, right? We all know how important that is. Reducing the cost to operate. It's about those efficiencies. Increasing utilization of technology. And I have to say, I'm a big believer here. I really think to transform the industry, we have to get providers not just to kind of utilize technology, which is some of the challenge we have with the technology that we are offering to them. It's really about that full utilization. And it's not just for that full utilization for the provider. Your ability to demonstrate outcomes will largely depend on providers' willingness to utilize those tools that allow you to have the data to demonstrate outcomes. And that is really, frankly, one of our struggles right now is getting providers to fully utilize the platform. Increasing quality, again, that link between business and quality, the level at which they participate in our network, how many of their services how many of our services are they using? So we've recently gone through Salesforce implementation so that we can do a better job of documenting not just did they participate in our business training series or did they participate in CDA, but what's really kind of the intensity of the intervention with that provider? How many things did they participate in? Are we doing a good job of moving them from one resource to the next in a way that makes sense for that provider? And Salesforce will really help us do that. And then lastly, on the larger, longer term outcomes, those things that frankly are really difficult to demonstrate and you have to be thoughtful about early on. Are we increasing provider income? One of the reasons we have interest in their tax data is that's a way in which we'll be able to demonstrate that, or some of the other technology tools that we're using. Are we reducing turnover? Are we increasing automation? Overall quality of their business practices, is that changing? And then ultimately, I think, are they more satisfied? Are they staying in the field? And then our ultimate aim, I think, like everybody in this room, is that at the end of the day having any impact on children? As we increase the quality of their business practices, increase their revenue, is that getting us to the desired end of really improving outcomes for children and families? So before I jump in and talk about some of our different technology tools that we're using, I've highlighted a few of those. I would really, particularly from those that are more seasoned in the room and have a network, I would really welcome any reflections or thoughts or questions. And then I can dive a little deeper and talk about what we're getting from each of those tools.
You mentioned you have mentors that help kind of steward folks through the licensing process. Are those other family childcare providers or are those staff?
So all of our staff typically are coming with either family childcare experience or robust childcare experience, but they are all staff positions at this point. And the licensing toolkit, honestly, is relatively young for us. So we launched we were scheduled to launch our first cohort at the beginning of 2020. I believe it was March, and we all remember what happened then. So things got pushed back a bit. So we have had providers go all the way through their provisional license at this point. So a great question, I think, though. We do that in a pretty intensive way. So it's hard for me to imagine doing that with family childcare providers that are also caring for children.
And yeah.
Thank you so much. It sounds like you guys are doing some great work. And I'm sorry if I didn't catch this before about how long you've been in business, because I think I love the toolkit idea. But a lot of the data that we've been collecting along with some of the research that Julia Brummer has talked about is that there's, while we're focusing on recruitment, that between the years of 3 and 5, there seems to be like this fall off and so forth. And so I don't know if you've been in business long enough to see, have you been able to change that, or what is the retention rate around that 3 to 5 year limit? And then I probably had a couple other questions, but I'll save those for later.
Sure, no problem. So yeah, I actually think that's a great question. Our toolkit's new for us to know kind of what the long-term retention in the field is. But what I will say is, because we have the staff family childcare network, we essentially launch a new provider, but they've already moved into the other resources and supports we provide. So I think ultimately it'll be a little hard for us to tease out what's toolkit and what's kind of the intensive level of support they get beyond toolkit. So most of our new providers are very quick to adopt the technology. So for example, providers going through the licensing toolkit, they are the early adopters of Wonder School. How soon can I get it? I want to use it. They're eager to take the business training. So they're engaged in other supports that we're providing that I think may ultimately color the impact there. Does that answer your question?
Yes.
Yeah.
We
don't have 3 years at this point. Okay. Yeah.
We have an online question from Megan. She wants to know how all this work is funded.
Yeah, a great question. So We do have multiple private funders that are supporting this work. We started with one private funder that was supporting the work, and we've since grown that to 3 private funders. We do also get additional resources from our preschool development grant. Thanks, Sharon.
So I'm sorry if I might have missed this because I arrived late, but the size of your staff and the number of providers that you're serving.
Yeah, sure. So we're supporting just north of 350 providers across Nebraska. On our staff, we have essentially Brandy Lingle, who leads the team, and then 7 quality childcare partnership specialists, or we call them all that, although some of them specialize more in licensing toolkit. Michelle, who's probably listening online, is really the queen of licensing toolkit. And then the collaborative staff, because I think maybe just important context, we are a larger organization, so we have 60 full-time staff. Because we are leveraging, I think folks will ask me, what are we investing in our staff family childcare network, or the size of the team? But I think just important in the backdrop, we are leveraging a larger organization where those resources may not be exclusively dedicated to the staff family childcare network, but are really an important part of supporting the work on this scale.
One of the things you mentioned was the procurement or shared purchasing. And I was just curious, are you using like a provider resource hub, or are there negotiated? I was surprised to hear that there was sort of a decrease in that interest following the pandemic, and sort of what do you think the long-term role of those shared services around what could be procurement and benefits and things for the network for your work?
Yeah, so interestingly, when we started, we really had 2 primary functions: early head start childcare partnership and these deep shared services for these large centers. And probably based on my experience anyway, maybe some of the most robust shared services out there. We did comprehensive HR, everything you could possibly do in the HR space, no HR staff in the building, and same on the finance side. For us, and procurement, and we've really moved away from that, not because there wasn't value, but we have spent a lot more time focused on our family childcare work and just haven't seen the same level of interest. I suspect that could be unique to Nebraska. No, I see shaking heads back there. We just, during the pandemic, there was definitely interest in the shared purchasing just because it was hard to get things, but really very limited interest beyond that. It's just not something that bubbles up for our family childcare providers, and also uniquely challenging because of our demographics, the geography, right? I can't get the things they want to Scotts Bluff as easily as maybe they can get it locally. And so we've just approached that in different ways. Even in the context of licensing toolkit, there are some things we need to get to them, and we've found that it's easier to get some of those things to them locally. I don't know, I saw a nodding head there in the back. I'm interested in your experience.
Yeah, so we have looked at the procurement and purchasing for several years. We've had some interest, and really what we found was just, we would have a couple interest in food service vendors for one thing, and then, somebody would be happy with their other one and didn't want to change. It was just, it just never worked out until the pandemic. Then we were able to work with our local United Way to provide PPE and tons of hand sanitizer and the wipes and the gloves and those kind of things to them. Luckily, because of our United Way, we were able to do that free of cost, but it was still getting them the supplies that they needed, which was much more important because there was a lot of times we couldn't even get gloves. So and now that everybody has tons of PPE, that really has slacked off, and we just don't see it.
Yeah, that was also very much our experience. We did it in a similar way. We provided emergency relief. And so it wasn't something we were charging for. We set up a system. I know there are some other states that have maybe had more success, but we just didn't have the provider interest there.
Just think we never knew what PPE was before.
True.
2020. I still wish we didn't, but we did.
I just want to highlight something you said about compensating providers for their professional development work. And I think it is so important when you're thinking about providers and how they're prioritizing their time and their days. And especially those providers who may not be in that most intensive experience yet. Because, when we look at programs across the country, that's something we see people really struggling with, is how do you get those providers to initially take that leap and start on this journey? And I think that's a wonderful strategy, and it really does recognize the professionalization of this field that is so critical to its onward growth.
Yeah,
So
we couldn't agree more and recognize how challenging that can be when you're trying to prioritize limited resources, but I think is really important for the message that it sends.
I want to build off of that. So I do have a question for you about that, because I love that idea too. I am also a co-founder with Jody over here on the Family Child Care Alliance of Maryland in the work that we have done. And that is something that we worked in there, is for them to have substitutes for professional development. The one thing that we've struggled with, though, is really getting them to do professional development during the day like a teacher would do, to allow a substitute into their program. It's no, I'd rather do it at night. I'd rather do it on a weekend. I want to know if you've had that same challenge, or are you just offering it at times that they feel best? I mean, it's been a real struggle.
Yeah, so the business series is offered at night, and we make a point not just of paying them, but also of feeding them. Recognizing that they're coming with no dinner. Generally, they've just finished their full work day, and otherwise it'd be 9 o'clock at night before they were getting to eat dinner. Although we're doing more virtually now, so less food, which just means more for compensating them. Generally speaking, we do evening and weekends, and really have asked our providers to kind of lead on what meets their needs. And what they tell us is they like something that's at least 4 hours, so they're getting good bang for their buck, and evenings and weekends. So
I just wonder what has been this kickback about in the public school system, and a lot of places we pay teachers during the day to go. And I just feel like I'm a former family child care provider too, and just giving up that time
With my own family and things to have to go outside of my work hours to do it. I don't even know how we change that mindset of, it is okay for me to take 2 hours if I have a substitute to do this training during the day, so that I'm not giving up that time with my family at night.
it's an excellent point. I think we've really just allowed providers to lead, but I think it's a great question.
So I can jump in and say that I know that in Wisconsin, they have this sub pool they call the Relief Squad. And they specifically designed it for that reason initially. Is anybody from Wiesen in here? Because and I think that they had the same experience. I've talked to Kelly Matthews about this a little. They're sort of scratching their heads too. A few providers are enthusiastic, but a number have said they really don't want, they're not excited about substitutes, right? Mm-hmm. And so what they're trying to do is to figure out how to have a dedicated person who comes somewhat consistently, so the families and the kids can get comfortable, so it doesn't feel like a stranger popping in. So that continuity, because you've got one teacher, it's not quite the same as the center where you've got other familiar faces. So anyway.
And it's also their home. I mean, I think, very important to remember.
I absolutely agree with all that. I'm from Wisconsin too. I was a provider for 17 years, and I at that time lived in the Madison area where we had satellite family childcare system, and they had a sub pool. And I remember as a provider at the beginning not being open to that idea. This is my personal home. These are families I've been caring for years and years and years, and they trust me with their babies. And I don't know who this person is that's coming in. I know you tell me that they're good, but I've worked in centers, and I know not all teachers are really great. And I prided myself on being really great in my program and wanted my kids to have that, even if I was not there. But I had a couple of situations where I really I had to get the sub, I needed somebody for something. And I got to know the person. And, to what you were saying, it's about building that trust. And I think trust is a huge thing in family childcare with everything you're doing, whether you're trying to convince them to use some technology, do, some new financial plan, or get a sub and go to a training. Building that trusting relationship with them comes first. And I mean, this is something that Donna and I have been working with, like she mentioned, the Alliance is one of our projects, and we've really helped those coaches to understand who these providers are to build that trusting relationship. And they've made some great gains because of the trust. But I think if we were to do a sub pool, if you could do something like, I don't know, even like a social night where they could all get to know the different subs, and they went to the same trainings together and they became a part of their tribe, that it would build that trust, and then they would be open to having those subs in their system.
Yeah. So the provider was getting to choose who their sub was. So it wasn't even a stranger coming into their house. It was somebody that they normally would use for a sub. So that was the interesting part of it. It was even, hey, I'm not even going to turn it over to my mom for 2 hours.
Sub pools are definitely a topic all their own. Yeah.
It comes down to the whole mentality of a family childcare provider, because I mean, you tell somebody, you tell anybody, oh, I'm a family childcare provider. They're like, oh, bless your heart. And they're like, it's like you're doing God's work and you're not really a professional. And that's the whole thing. You don't see yourself as a professional because the majority of people don't see yourself as a professional. So you think, oh, I can't go. I took off a day last week because I had to go to the doctor. I can't take another day off to go do some PD. I can't do that to my families. I can't do that to my families. That is the mantra.
True. Very true.
And one thing I've been thinking about a lot lately is this idea. So when I was a teacher at the end, I was doing a lot of flipped classroom work, which was fantastic. And a flipped classroom is where you would watch or learn the material before, and then you come to the teacher with your questions or your, need for additional help. And so I wonder about, is there a way to do some anachronous learning for providers where they're viewing materials, where they're learning concepts in their own time, right? And they can do that anytime they want. And then they're coming together in a hybrid experience, like we're all together today. I really enjoyed this experience for the last couple of days, getting to talk to other people. And I just wonder if that might be a way to solve that. I can't leave my kids,
I actually think that's a great point. And in the context of our staff family childcare network, we do utilize a virtual learning library for some of our professional development to give providers that opportunity, not the nature of the business training series, which is a more intensive experience, but for those 1.5 hour trainings that you might need, we do have those in a virtual learning library for providers, and we're certified to deliver professional development credit for the state of Nebraska for that purpose. So yeah, I mean, it's a really an important thing to think about in the context of staff family childcare networks. Yeah, great point. So I'm just gonna, yeah, sorry. Go ahead. No.
So and feel free to say you don't want to share, and that's okay. But I think from my chair, I'm trying to get a sense of cost to staff these networks and to make this an effective plan for us. So is there anything you can share about from a budget perspective, if you don't have it now and you are going to start it, what kinds of dollars you think we're talking about?
Yeah, so I think it depends on your intended reach, right? So not that nothing I'm not willing to share. We did actually work with OpEx to do some unit cost analysis and learned a few things doing that. So what I could tell you is, if it depends, are your providers primarily going to be concentrated in tier 1, tier 2, or tier 3, or whatever your structure is? What we did is came up with a unit cost for each item that we're delivering, and then a unit cost for the tier. But we learned in that process that it wasn't as simple as just saying it costs X to have a provider in tier 1 and Y to have a provider in tier 2, because it doesn't work that way, right? They shuffle back and forth between those tiers. So I do have some cost information I could share in terms of how we thought about our unit costs, and what it's really all in your HR primarily and your technology platforms, what you're spending. The one other thing I would say that we learned around cost is the individual business consultation was a huge cost driver for us. And we stopped doing it in the way that we initially set out to do it, and found that more that peer group TA or affinity group TA was a much more efficient way to deliver that service. So I'd be happy to leave you with a card and we can exchange some more detailed cost information if that's helpful, and for anybody else that's interested.
And I think Opportunities Exchange has some great examples on our website of programs with actually, I think there's like 3 or 4 different plans that are on there that gives great information on that also.
And I really feel like the cost driver is the people. So it depends on how many staff or how many providers you intend to reach and how intensively you intend to support them. And initially, because we had the luxury of supporting them in a very intensive way at a very challenging time for the industry, that's what we've chosen to do. Over time, our perspective around that, I think, will change a little bit. Like, you have providers that don't make a lot of progress, don't utilize the technology with a lot of intensive supports. You have to start thinking about whether or not they're the right providers for your network, because they become a kind of a drain on the resources you have.
So we have a comment. Luann in Vermont says a possible funding strategy would be around this pool substitute relief during the day would be for like state subsidy systems to recognize, to give some additional closures, opportunities, some more hours or something. I'm not saying this, I'm not articulating clearly, but the idea is for the system, at least the state system, to acknowledge that daytime PD for home-based providers is a legitimate time usage of their time and should be compensated for. Did I make any sense? Okay.
Is there another from the floor?
Was there, yeah.
Providers don't pay anything?
Our providers don't pay anything. And our commitment at the beginning was when we could demonstrate return on investment. It's part of the reason we did the unit cost business analysis and part of the reason we did the tax prep. When we could demonstrate return on investment, we would start talking with providers about putting something in. And I know there's been a lot of conversation about that at this conference. I do think it's a really important consideration. You do have providers that you are intensively supporting with technology or other human resources that are not as engaged as they should or need to be. So I think it's a really important consideration. We were launching in the middle of a pandemic. That was really not right. We were trying to figure out how to shore them up.
So I would also just add to that. So as you know, OpEx says, there's a whole myriad of ways to do this. This project really raised a lot of upfront capital, right, to be able to offer this. There are other groups that are a lot more bootstrapping in their approach. And one of the things that we've just recently gotten interested in is leveraging the relationships and the money that is kind of already existing in food sponsors. Because we're doing a little bit of this in Indiana. If you think about it, an organization that is a food sponsor for a group of family childcare programs is already a shared service, right? So building on that and beginning to add more business tools to that it's a terrific idea. We're sort of beginning to experiment with it, and we'll let you know how that comes out, or you can experiment. But so there's already funded staff, there's already a budget, right? And so then it's kind of leveraging what you have and the incremental cost of adding some additional services. So it's another way to think about it.
Yeah, and not be transparent about, I think to Sharon's point, we were operating at around $1 million a year, and we had multi-year commitments.
I think that leveraging piece is so incredibly key to this being successful, long-term and sustainable. And every resource and referral is already a shared service network. I mean, if you are an R&R, you are a shared service network. You do a lot of the core functions. You can layer on additional supports that often will fit within your funding. CCDBG funding is very broad, and it really all aligns with quality and expanding access and capacity. And I think if we can see ourselves as R&Rs, as already for 50 years having been shared service networks, and just being more intentional around the data that we're collecting, and how we're telling the story, and how we're layering on all of these different funding streams that we're all taking advantage of to make this last long term. When we were developing our shared service approach, we did some listening throughout we met with people throughout the country and asked, what have you learned? What was this question around sustainability? Every time we asked that, and everybody said to us, once they started charging, it completely fell apart. And even if you could show a return on investment, it was like, well, that could be part of my income that, that I don't want to put into this anymore. And so for us, we're really, really committed to figuring out how to leverage all of the many funding streams we have, including our subsidy and the systems that we can pay for with our subsidy dollars that support shared service work, to build something comprehensive that will last and live on its own.
Right. I mean, I think truthfully, until we change the way in which we're compensating childcare providers, to think that we are going to fund this work on the back of childcare providers is probably not very realistic. So I think for us, at some point, it might be about having enough buy-in from a provider, even if they're able to demonstrate that in other ways. So.
Patricia and I got the opportunity to work with Mr. Rosen in Florida, who actually had, he actually supports a community, and he actually paid every family childcare provider in the community. As a school there, he pays for every child in that community to go to college and so forth. And when we were talking to him, he said the one mistake he saw big funders make is, he said they want to come in and drop money for 3 to 4 years. And he said we need to even change funders' mindset to say, no, this needs to be a 20-year commitment, not a 2 to 3 year commitment.
We would all like to have those 20-year grants, wouldn't we?
Yep.
Yeah. So I want to touch on, since in part the objective of today's session wasn't just to talk about what we do in our staff family childcare network, but also to talk about outcomes. I do want to touch on some of the ways in which we're leveraging technology to demonstrate those outcomes. I'll be, again, perfectly transparent. This work is very young. And so we're just now really formalizing how we think about this. Somebody in the opening session this morning, I thought, put it really well. We're collecting all of this information. We now have housed all of this information in Salesforce, and we're still figuring out what to do with it. So bear that in mind. Oh. Can you?
Did it stop again?
Yeah, I think so.
Yeah, it has to do with.
Yeah, oh, no. Back we go. Can we go back a couple?
Yes, we can. Let's see. Tell me when.
There we go. Oh, one more forward. Oh, thank you. One more. Oh, there we go. So we have the privilege in Nebraska of working with a group called ECD Measure. They are a global early childhood organization that happens to be based in Nebraska. Dr. Abby Rakes, who is at the UNMC School of Public Health. And we are piloting a new tool for assessing our family childcare providers. And we're really doing this for a couple of reasons. I think for many family childcare providers, the figures can be intimidating, and it doesn't necessarily kind of bring the collaborative spirit to the work that we want to bring in our staff family childcare network. So they really have a tool that has honed in on those key elements. And I'm gonna just, really designed to capture kind of the key components of the interactions between teachers and children. Gathering some really context-specific evidence on quality. So they're honing in on some of the same elements that you're honing in on with the FICRs. There's an easy-to-use checklist. They do actually use it in other countries and in Nebraska. So we get to be the US-based pilot for this. Really a research tool intended to be formative in terms of the nature of assessments. And this is maybe really the key piece. So those core constructs and items, a flexible tool, most important parts on the right-hand side. This includes a self-assessment for the provider, which has really turned out to be a very important part of the work that our coaches or mentors do with those providers. And then there's an observational tool. We have education coaches that go into the family childcare home and do an observation. And then that self-assessment and observational tool really is what we're leaning on in terms of the data, but in a lot of ways, a much more collaborative process than some of the traditional assessments that are out there. The data we collect through this, we use to set goals with the family childcare providers. So Becky is one element and a really important element, an element that starts early in the life of our providers in that elevated network. Wonder School, again, I know you've all probably had plenty of exposure to Wonder School during the time that you've been here. Wonder School, one of the reasons we bought into Wonder School, and if Brandy was here, she'd say, don't look too close at that data. That was just to give you a picture of the dashboard. One of the great things about Wonder School isn't just that it gives our provider data, so that coaches can work with the providers around those data pieces. It gives us data across our entire alliance. So having access to data for all of our providers becomes a really important point of information that helps us not just drive coaching, but drives our strategic thinking about the services and supports we provide. Pie for Providers, Chelsea, who's also running around at the conference here. This is really about streamlining subsidy. Chelsea describes it as the TurboTax for subsidy billing, which I think is a great description. I think part of why it's important, not only does it streamline the process, and Chelsea has been able to adapt that to the specific requirements in Nebraska, doesn't just streamline the process, it mitigates the risk for the provider, which for some providers is why they choose not to participate. Administrative burden is big, we all know that, but nothing's worse than finding out you have to pay the state back because there was an error in your subsidy billing. And this really allows the provider to both make sure they're capturing all of the revenue, but make sure they're also not billing for a day or an hour that may not be available to the child that they're serving. So it's really reducing that burden, but also reducing the risk. Very cost-effective tool. Again, this helps us support providers because it's another data point that's available as we think about outcomes. Sure. So essentially a provider can use the information that's in there to much more quickly comply with the state requirement. So in Nebraska, like, should I say fax? I think there could actually be a fax involved. It is a very paper-based system, or you're uploading. It just allows the provider to do that much more quickly and much more reliably. Anything you want to add on the pie front? I only have a Nebraska lens, so.
Well,
yeah, this works. Yeah, so an example of how it is, Chelsea customizes it for the state. So every state has a different set of rules around how many absences are you paid on attendance versus enrollment, right? So like it writes the rules into that. And then I think one of the things that's most helpful is it shows the provider based on the inputs how much money they should be collecting. And so a lot of times, folks are really busy, they get paid, they don't really have time to go back and reconcile if they got less and understand why. And so I think this is a tool to help them with that.
But it's not a direct API.
Right.
We did negotiate data sharing with the state for us to be able to have the information, or for PI to be able to have the information necessary for providers in Nebraska to utilize it, and also for the customization.
So Courtney has a question. Is PI for Providers available in other states? It absolutely is. Do they have a website? I'm not sure.
Yes,
They
it
do.
does have a website. And I will say, in terms of the technology tools you might use, this is very cost effective. It's far less expensive than some of the other tools we're using. I believe is it $25 for?
I don't know what the current pricing
Yeah.
is, but it's really,
It's very
it's very affordable. So Courtney and anyone else, you can Google PI for Providers. If you have trouble tracking that down, you can always email someone at OpEx and we can help make the connection with Chelsea Spray-Regan is the sort of brainchild and software engineer behind that.
And one of the beauties of this tool really is the interface for providers couldn't be more simple. They have done a great job of making this interface very easy for a provider. We piloted with a small group in Nebraska and got very positive feedback and have now opened it up. So we're really in the early stages of thinking about child outcomes, right? The hardest piece to get to. And I think because we've had good luck with the brief early childhood quality inventory that we refer to as Becky, because that's a very long name. We are looking at, we are working with our partners that created Becky to integrate a child assessment, which would hopefully allow us to get to that child outcome piece. Also looking at whether or not the coaching that happens as a result, or what we'd like to describe as mentoring, and maybe just to be specific about why we call it mentoring versus coaching. How many of you have other coaching efforts in your state? In Nebraska, we have so many that it's really challenging when you talk about coaching. It's like, which coaching? So we have really referred to it as mentoring to distinguish ourselves kind of in that coaching space, but also because it seems to be a little more, providers are a little more open to the idea of mentoring than coaching, maybe because they've been inundated. So also looking at whether or not that mentoring is demonstrating any change over time in some of the behaviors or things that we are looking, those evidence-based practices that we're exploring with the Becky. And using the Becky as a tool for helping providers focus on child development. So the things that are really embedded in the Becky assessment are things that help providers focus on math or focus on science or focus on their play-based interactions. So things that we can really focus on with providers that get us to better child outcomes. So just to kind of come full circle and how we are thinking about outcomes, that self-assessment and observational visit from the Becky, a really important part of the journey with providers at the beginning. There probably really should have been another arrow here. The other data that we're collecting from our technology tools like Wonder School, like Pi for providers, also informing how we're mentoring those providers, being informed by all of those data points, how we're setting goals, how we're regularly mentoring with those providers to help them change the things we're seeing in those tools. That's getting us to provider outcomes. I think we all hope that with better provider outcomes, we'll get to child outcomes. For us, I think we will be integrating an assessment to demonstrate that. I think because we have had the good fortune of having a large private investment as well as some public investment, there is some pressure to demonstrate outcomes in a relatively short period of time, which whomever said 20 years, that would probably be a more realistic ramp, but that's really not the ramp you typically have with philanthropy or public sources. So that child assessment may help us demonstrate that a little more quickly, that we are ultimately getting to those child outcomes. So I think I really kind of touched on these points. I think that maybe the first point is a really important point. I think we'd all like to think that the need we see in the community, both family childcare providers as well as small centers, frankly, who are often not that different from our family childcare homes, that demonstrated need is not sufficient. I think for anybody that has launched a family childcare network or is thinking about launching a family childcare network, really important that you're thinking upfront about outcomes, because to continue to leverage the kind of private or public investment that we have leveraged, it will require the ability to demonstrate those outcomes. And I think particularly if we wish to have sustained investment. I think in the context of the pandemic, it's a little bit easier to generate both that private and public investment in childcare, but we see this as work that we hope to do for the long haul. So I'd love to hear from you all about how you're thinking about outcomes in your work, whether or not it is you're at the beginning of the journey with a family childcare network, or whether or not you've been doing this work for a while. And otherwise, if I stand between you and lunch.
Actually, lunch is late today.
Oh, no.
So
I don't stand between you and lunch. That's
no.
always good.
Hi, so we've been, as I mentioned, doing a organic family childcare network for a number of years. And one of the primary goals of attending this week, it was understanding the need for capturing the outcomes and having a not only a childcare management system that is uniform for the providers in our network, but also having the kind of the hub management system for the support. And we do very intensive hands-on technical assistance support on a weekly basis, trainings. How are you saying you've been able to capture those outcomes through Salesforce and some through Wonder School, or
Yeah,
what does
so
that look
I think
like?
for us, this early period has really been about capturing the data, right? And that was like phase one. Phase two for us has really been about organizing that data in Salesforce. So we recently went through Salesforce implementation, and really kind of the thinking there is twofold. It's not just about capturing the data for the Staff Family Childcare Network, but if you are a larger organization, you are likely also leveraging other organizational resources. And so we wanted to make sure we were also connecting the providers in our network to the other resources we have as an organization. And Salesforce is a bridge to help us do that. For the R&Rs in the room, I would imagine it's a similar situation. So to give you a very concrete example, we do emergency assistance for families with children, something called community response in Nebraska. We wanted to make sure that if we had a family childcare provider that needed emergency financial assistance, that they were getting connected. And without a system where everything's kind of landing in one place and we are able to integrate those services, you're relying on, team member A to tell team member B, who maybe they see once a week if we're lucky. It's like passing ships in the night, especially with all the virtual work that goes on now. So we're really using Salesforce to make sure that our services organization-wide are integrated, but the data tools you see here are really about providing the best services to our family childcare network, but also making sure that we're really coaching to the data that we see in the systems that we have.
So we have another online question from Madeline, who would like for you to speak a little more about baseline data. Like, how do you measure change? You have to have baseline to measure change. So that can be hard to collect baseline. So can you talk a little more about that?
Yeah, sure. So I think one of the ways we do that is through the self-assessment and the observational visit through the Becky. Another way we do that is through the Wonder School technology platform. When we saw that enterprise dashboard for the very first time, I rubbed my temples a lot, right? The number of providers that didn't use an invoice or had lots of uncollected revenue or bad debt. So some of the baseline data is coming from the technology tools we're using, and then Pi in a slightly different way. So I think your baseline data, we started with the Wonder School platform from the beginning. And so in some ways, I think that's informed our baseline data and added the Becky not long after that launch.
And just every CCMS is a little bit different. Wonder School has an inventory that they do with their providers to start with. And so that's how you know things like, are you sending out regular invoices? Are you, do you have chronic late payers and that sort of thing? So it's a great strategy. You will need to think about that though, really early, because once it could be a small window, right? Especially if you have early wins. If you get providers onboarded and they start doing electronic billing and their bad debt goes down, you want to know that it used to be bad. So you got to figure out what your strategy is. If your CCMS doesn't do that, how are you going to get that information? And then of course, as Carla said this morning, they did a survey, they asked questions, but a lot of folks just said yes, 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 right? And they didn't know. So there's provider report, but that you have to have other strategies. And I'm actually going to give the mic to an evaluator to talk about that for a minute.
So one of the things that I just want to say to everyone is when people hear the word evaluation or they hear kind of collect baseline data, it can be really scary. And I would say, if you're thinking of starting something like this and you're like, gosh, I can't, buy a CRM or something to manage it. What I would say is, if you've got 10 providers who are starting this work, get an Excel sheet and ask these questions at the beginning of them, because, we're not looking at huge data sets yet. We're looking at a smaller number of data sets, because that data is better than no data, and it can get you the building blocks that you need to start to move ahead. We do a lot of evaluations where people will say to me, so I've been doing this program for 10 years and I've got a lot of file folders with surveys and paper things. I'm like, okay, great. So we digitize that, but it's there and they have it. And so instead of saying after 10 years of something, I'm ready for an evaluation now, but we'd like to know about the past 10 years, you can say, well, we do have this data. It exists. It was already collected. Let's look at it. Let's use it. And you're already, part of the way there. So I would say if you can't go for the big CRM now, don't be discouraged and just don't not do it, but think about what can I get at a small way that can then help me to build my data collection in the future.
And we actually started with just that, a spreadsheet. And then when the spreadsheet got to be mind-boggling, we knew it was time for something else. Yeah.
So at the Family Child Care Alliance of Maryland, one of our biggest projects is a pre-K project for family child care. And so data was very important for us because this was a pilot project. And so we collected baseline data in a number of ways. So one of the first things we did is we did the balance survey, which really understood personal needs versus business needs versus educational needs. And Patricia and I did that work. We also did baseline data around pre-class. We did class pre and post. I believe in data to verify data, right? Because I knew child outcome data was really basically going to be crap the first year because of the fact of providers just learning a new system, right? And that was going to be very up and down. So how could we measure growth? We did fidelity data pre and post. We did like I said, class data pre-post. We did look at child outcomes. We looked at professional development. The first year, we saw that there was a lot of need in business. So we brought in Wonder School the second year. So using our data to really inform what we need to add in the second year. And so we're now looking at Wonder School data to see. And so again, we used multiple forms of data to get baseline data, and then we'll use it for post in order to try to tell this story, because while the child outcome data might not look great, we can still show provider growth in a variety of ways. And that was important to us.
And I should say, we also do baseline pre and post on our business training series. So we have another data point there. Other questions? Well, I appreciate what a robust conversation this was this morning. It was really fantastic to meet everyone and hear about the great work that's going on around the country.
I'm a bull in a china shop. I just want to say we have 18 participants online.
Oh, yay.
Yeah, we have a great group of folks. I've been trying to make sure we answer their questions.
Surprised my team back in Nebraska is not chiming in. Anytime you're the CEO, just enough to be dangerous, they'll tell me all about it when I get back.
Yeah, right. All right, so the next session, so we're ending a few minutes early, but not much. So the next session starts, I think, at 11:20. And actually, one of your staffers is going to be in here talking about language development.
Yes, we have a partnership with Lena and our Early Head Start Childcare Partnership. And so our educational coaching manager will be talking about those services.
And then lots of other things. And then, so one more session, and then we're back to the plenary, and Louise is going to close us out with what's next for shared services. I can't wait. I've deliberately not looked at her slides or presentations because I don't want to spoil it. She's so good at that work. So so you are dismissed. There may be some snacks, and on to the next session. Thank you, Shannon.
Thank you.